Hey tootRN fam, here's a question that I use often with my students that are doing NCLEX review, and this is one of the questions I would say lately that's really been stumping a lot of my students. And so I wanted to share it with everyone here so we can look at it together and maybe learn something new and maybe learn how to work through a question like this that feels a little tricky. So let's read it. It says, a client with cirrhosis states that his disease was caused by a blood transfusion. What information should the nurse obtain first to provide effective client teaching? So option A reads, the year the blood transfusion was received. B, the amount of alcohol the client drinks. C, how long the client has had cirrhosis. D, the client's normal coping mechanisms. So first thing, as always, what is the question asking us? So we can find our ask here. It says, what information should the nurse obtain first to provide effective client teaching? So all that really means is, what do we want to get first in order to provide teaching, effective teaching to this client? Well, what's our problem? So all the data the question gives us is that we have this client with cirrhosis, and he says that it was caused by a blood transfusion. So our ask is, what do we want to get first from him to provide effective client teaching? And this client's got cirrhosis and says that he got it from a blood transfusion. So when we're thinking about outcomes, trying to find our solution, we have to think, well, what do we know? We know cirrhosis is a disease of the liver. We know that you can certainly get cirrhosis from something like hepatitis, for instance. You can get cirrhosis from things like alcohol use, drug use. So there's several ways that this can happen. The patient says that he got it from a blood transfusion. So let's look at our answer options. Which one of these, thinking about outcomes, is going to help us to provide this client effective teaching about what he said? So A says the year the blood transfusion was received. So this could certainly be helpful in providing effective client teaching. If we know when he received the blood transfusion, we can talk about how that may have been caused by the blood, or if it was likely not caused by blood. So more specifically, before 1990, we know that blood wasn't tested for bloodborne pathogens like hepatitis. So there certainly was a potential that you could have contracted something like hepatitis and now you have cirrhosis. If it was after that, it's not likely that would have happened. B says the amount of alcohol the client drinks. So yeah, drinking alcohol, alcoholism, that can certainly cause cirrhosis. However, there's nothing in this question that says the patient drinks alcohol. You are assuming the client drinks alcohol by asking, how much do you drink? And we know that alcohol is not the only way that you can get it. And to even drive that point further, the person says that he got it from a blood transfusion. So it can't be B. C says how long the client has had cirrhosis. So certainly important piece of information, but again, bringing it back to what we were being asked, bringing it back to what the problem was, does asking the client how long he's had cirrhosis help us to provide effective client teaching about what he said? Is that the first thing that we want to ask? No, because if he says he's had it for 5 years or 50 years or 1 year or 2 months, that doesn't help us to provide effective client teaching to what his point was. I got it from blood. So that's not the first thing we want to obtain. D says the client's normal coping mechanisms. Again, great piece of information to have, but does that help us to provide effective client teaching to know how he copes? It doesn't. Because even if he says he copes by taking a walk, or hanging out with friends, or watching a movie, or eating his favorite foods, this doesn't help us to provide effective client teaching to what he said. I got it from blood. So B, C, and D, these things aren't the first thing we're going to obtain. It doesn't help us to teach the client effectively about what they have shared, the information that we have that says, hey, I got this from blood. So A is the correct answer here. This is going to be the first thing that we want to obtain from the client so we can provide him effective client teaching.